Hi, Zuwena. Welcome to the podcast. How are you?
I'm doing well, Dr. Huntley. How are you?
I'm good. Happy Monday. As we are recording this, I typically recording on Mondays. Let's start at the beginning. Why don't you tell us a little bit about yourself?
Sure. My name is Zuwena Plata. I work as a consultant epidemiologist with you, Dr. Huntley. But also, I actually come with a pretty interesting background. I actually was working with you beforehand as a research assistant and kind of have now morphed into this new role, which is actually really exciting. And so my background is actually a mix in both biology and public health. So I have my bachelor's in biology and public health with a concentration in peace, justice, and human rights. And that's what really led me into pursuing public health. So I also have my master's in public health with a concentration in epidemiology. I would say that I consider myself a little bit of a Jill of all trades. Even before I had gotten my bachelor's, I was doing basic science research. I'd done some community development work. I'd done a little bit of entrepreneurship summer programming, even in high school. And then from kind of college onwards, I really focused on doing more working with physicians' offices, doing research, study coordination, working in biotech, pharma, a little bit of government work, a little bit of academia, and now I've come to where I am now. So a little bit of everything.
Yeah, that's really nice. I like to hear that. And I think a lot of people are a little bit like trying not to have, they say, oh, I've done all these different things. It doesn't fit. I think that's appealing, especially the way that we do public health nowadays, no matter where you are, but especially in the role here, because we have such a variety. You never know when some skill set or experience you need to bring it to the table. So glad to have you with us for sure. Why don't you describe a little bit about the work that you do here, kind of what you've done so far and what we're doing, what we're working on now?
So when I started more so in the research assistant capacity, I was helping facilitate some of the projects. So working on community health needs assessments and really just understanding what those are and how those would be laid out and how we would execute conducting one. But then also working on a little bit of a hodgepodge of facts, epidemiology fact sheets for different chronic diseases and what that would look like and how we could actually work on improving communications. So that was really a great opportunity to delve into my public health communication skills because I think I spent a lot of time normally or historically in data. And so it was really a great opportunity to kind of get myself on the other side of I know the numbers, but now, okay, how do we share that information outwards? And so now I kind of get to dive back into the data side and the information side, working more in the epidemiologist role, but also now bearing in mind the way that we communicate is important. So right now I've been doing some data equity related work on some of our projects here with Indigenous populations, and then also really focusing on not just writing, but also understanding data and actually applying some of the research that I was doing in the beginning.
Yeah, I like the variety. I mean, I think in just the time that it's been about maybe 6 or 7 months now since you started working with us, somewhere in there.
Mhm.
Just the variety that you've been able to touch on in terms of skill set. There's definitely that research piece that never goes away. There's a lot of writing, a lot of thought process into everything that we do, right? So for overthinkers, this is like the job,
There's always something to do.
which is kind of how we ended up here. We found ourselves going down a lot of rabbit trails as we work on some of these projects, which start out very straightforward. Like, okay, I need you to, really dive into this and look to answer these questions. And as you begin to go down that trail, you discover this, and under this rock, there's, oh, look at this stuff. Now we have to think about it. And we started having these conversations in our catch-up meetings and talking about like, oh my gosh, let's go a little bit deeper on this, because I think for both of us, it adds an element of excitement about what we're learning. And it may appear to be a rabbit trail, but there's a lot going down. Allowing yourself to explore to a degree helps us to get more information, go deeper, so that we can serve our clients even better. And then naturally, we started to see how this was also spilling over into personal life. I think this has always been the case for me. And I've gotten so used to it that I just kind of, it became that second nature. But then when you and I started talking about this project and how it was showing up in different aspects of your personal life. It had to be came like a fresh perspective for me. It was like a refreshing kind of. It was great to see and to hear from you as well. But this is the kind of thing that we talk about in public health circles. How we need to have develop meaningful relationships and being authentic and really getting to know the community. Well, a lot of that comes from us as the professionals really being connected and doing this work that's meaningful to us because it will naturally spill over into our personal lives. And I think that's another way of disseminating the information, teaching without being in their face kind of thing. And then always a student of learning because we're constantly learning something new. My big question for you in this conversation today, which I think this will probably lead into multiple conversations, but my big question for today is how has the work that you've been doing, you can consider any of the work since we've been working together the last several months, how has this work, this meaningful work, been helping or spilling over into your personal life? You have some examples of how it's gone beyond the work 9 to 5 and then kind of beyond.
Actually, in thinking about this, I went back to some of the work that we were doing in the very beginning and realized that it's always been there. This is kind of concept has always been there. So even going back to some of the fact sheets that we were working on in the very beginning, it was actually, I believe it could have been working on things related to diabetes and other chronic illnesses that tend to impact BIPOC communities, and realizing that, oh, as I'm looking up information to develop these fact sheets, I'm also seeing information that is useful to my own family members. So, family members that may have some of these chronic conditions, or it's a concern because there may be a family history for some of these things. And so then I'm working, and then as I'm talking to family members, either on the phone or in person, I'm thinking, oh, I'm working on this project and you'll never guess it's on this, and sharing information. And this is what you're supposed to do. I know this is what you're supposed to do, but there are studies. And did you know that? And then just kind of rambling off numbers and kind of bringing myself back in. And these are things that you can do. And did you know? There's a lot of did you knows that kind of pop up, and
Yeah.
sharing of information that way. And it's been actually really great because then it opens up the conversation a little bit more. And I know for sure that some of my family members have probably grown a little bit tired of hearing me go on about some of the things, but I recognize that when I'm really excited about something, I'm really passionate about something, and I can just clearly see a link between two things, I'm going to go for it. And I apologize sometimes in advance, and then sometimes I apologize afterwards, or sometimes not at all. Sometimes it is what it is. But I just find that it's been really great in facilitating conversations and even learning more about my own family and family histories and things like that. So it's been taking kind of more generalized information, applying it to family, and then actually getting feedback from my own family and even from my own friends. And I found that to be really enlightening, where it's not just a one-way street where I'm sharing information, I'm actually getting things back.
Yeah, I think that's great. Sometimes that can be overlooked, but like you said, when you're excited about it, you want to share, and the people closest to you, especially if it's like you said with the condition that's already impacting your family, then your excitement opens them up right away. You're a trusted resource. And then sometimes I've done this with my family as well, and close friends. Sometimes when we open it up, especially as we think about BIPOC communities, and we share some information that we've learned, sometimes that opens up the stories,
Mhm.
and then we'll hear a story about how great Uncle so and so went through this, and from that story, we get to hear how our communities have always addressed this in this culturally appropriate way. I know this happens a lot in indigenous communities where they talk about the traditional medicines. And one of our clients, their foundation is on traditional medicines and really honoring that. So a lot of times when I've shared with older family members, they start talking about historically how and food is a very core element with my family stories. A lot of the great stories center around a dinner table or sharing a meal together. So a lot of times I hear stories about how they were eating for health, cooking a certain way. And then so while we're sharing that information, we also get to receive some special cultural aspects and some opportunity to learn, maybe even understand why things were done a certain way from the stories that they then open up and share. So it does position us to be able to pour into them and, like you said, start the conversation, because a lot of times they'll give back to us something that we didn't expect to hear. That's been my experience.
Absolutely.
So what are some other examples that you can think of in terms of how this work that we get to do is kind of spilled over into your personal life?
Actually, a more recent example, since we've been working with one of our clients that focuses more on Indigenous populations, I've actually found a lot more in terms of resources or just acknowledgement of the impact of colonialism on Indigenous populations in the United States. So there was one weekend where I decided, probably on a whim, to go to the museum. I'd planned to do something else, it didn't pan out, went to the museum instead. And on one of the floors, there was a section referring to the Indigenous people of the land that the museum was clearly built on, and that obviously the city is built on. And acknowledging the land, but also the importance of land acknowledgements and how they can be beneficial. So I recognize that some individuals feel one way about land acknowledgements and others feel more, they're just different opinions. And so getting to see that, but then also as I was going through that kind of Indigenous American section of the museum, just the acknowledgement of kind of the history and not just, I guess, the version that you kind of get in elementary school. And now as an adult, you see, oh, okay, this is not exactly the story that I was told as a child, but but it was also very honest and also referred to, some of the artifacts that were present, and also mentioned that this certain item may have used to have been on display, but it is no longer in our collection because we have returned it to the Indigenous people and the tribe, so that way they can do with this particular piece of history as they choose to. And so I found that to be really enlightening, because I know that's something that we talk about when it comes to Indigenous populations and their sovereignty and so on. And so it was just really great to actually see an institution doing that. So it was almost like, oh, the pieces are clicking here and I'm seeing it and what it could look like in the real world, not just from an academic point of view or just from, being on the side of the screen, but actually seeing what it plays out like in the real world. So that was actually one of my favorites, because I remember walking out of the museum like, oh my gosh, I can't wait to talk about this.
Isn't that nice? I mean, that awareness, it hits that way for me too. It's like something that we will recognize because of the work that we do with the tribal organizations. And I feel proud when I see that. I recognize it. In fact, one of the places that we like to travel is in the mountains, and it's sort of trifecta. It's a part of the Smoky Mountains that some of our time is spent in Tennessee, some of our time is spent in North Carolina, and there's a large Cherokee reservation in that area, right on the line. It's mostly, the actual reservation is on North Carolina property, but it's just like a few miles from the Tennessee. So there's a large presence in that area. And I am so aware of just so much when I go through that area. Even if I'm not on the reservation, there's in that area, it's common to see the street signs with the native language, the name written in English, and then the native language like scribed right under that, right there together on the sign. And I don't know, I get really excited when I see that. When there was, the American Public Health Association opens on their opening general sessions, they read the land acknowledgments during that part of the session, which I can appreciate even more because of the work that we do. So it does. I know that feeling like you just want to tell somebody, you want to be able to talk about it a little bit more. And I want to see more of that. But it's nice that what we do or what we are recognizing and seeing, like in that museum, like I wonder how long that's been there. But now that you are doing this work, it really stands out. I just think those things definitely warm my heart and kind of get me excited about the next project or continuing on what we're doing. And it's an honor to be invited to do this type of work and to be able to work with these organizations. So that in itself is a treat for us.
Absolutely.
I think that for us, there are so many things that we will continue to talk about through this podcast, and you and I will talk about it constantly because of the work we do, but I think bringing some of that to the podcast, because I think it's an opportunity for other people to kind of reflect on what they're doing and how does it connect with who they care about and how they're serving, regardless of if it's a BIPOC community or not. But I think for us, it's everywhere. I'm going to share another example that popped in my mind as you were kind of talking. But do you remember going back to kind of the fact sheets?
Yes.
Do you remember that, when early on we were talking about, I mean, there was a whole bunch of things. We got to the point where we started either a document or a spreadsheet where we just would put our ideas. I
Mhm.
think we have a document and a file somewhere where we put our ideas that these are good. We may come back to this, but right now we have to keep on the project. So we would like put our ideas all in a document so we could revisit them. And I know there are several, but one that stands out to me right now is how symptoms are described about a condition or disease, and how we immediately were like almost attacking so much of this, because how we could see how this, regardless of the well intent or whatever, it does not represent our BIPOC community people
Mhm.
that we work on all the time. So for example, when there's a symptom that says raised red rash, well, really, how does that look on brown skin or dark skin?
Right.
So those are just some of the things that popped in my head when you were talking, because that sparked a lot of conversation for us. We have a list of things, and I probably could pull it out. Maybe that'll be an episode all by itself. But there's a list. You remember that?
I do. I do. And it actually really reminded me that so much of what we do, I guess, because by its very nature, public health is meant to be applicable, right? And I think that a lot of the times we really get in the weeds. And I think a lot of people who are in public health, unless they're doing something that's very directly impacting the community or they're working out in the field, it's so easy to get lost in the numbers, to get lost in the data, to get lost in this particular way of doing things that we forget to actually see the impact or what it looks like in practical application. And so for me, having the opportunity to work on those fact sheets, even the projects that we're working on now, seeing how it can spark these conversations that we're having and just getting to have different point of views, even from conversations that I've had with friends related to other topics not related to indigenous land acknowledgements and the history or even certain health conditions, but just how they identify, how they move through the world and how they see the world and what their experience is, and how even though we're friends and we're quite similar in some ways, how their experience can be so different from my own. And so that has been really
Yeah.
kind of enlightening, or how even my perception of them and their perception of themselves and how they move through the world and what they experience as just as other human beings. It's been just really enlightening. And I've been able to take a lot from it. And I've been able to do a lot of self reflection too.
Yeah. I think that's been great for me to see. And it's a shared experience. It gives us, we constantly have something to talk about. I remember even recently we were talking about a social event, holiday event, and
Yes.
you're getting to know people, and your mind is automatically like, oh, we need to talk.
Yes, my brain went running. I went to a holiday event and I met somebody who does health equity research. So, in particular, implicit bias research. And immediately my antennas went up. I got really excited and I said, okay, you'll have to forgive me for the moment, but I'm really excited because I'm working on this project and I can't contain myself. Thankfully, I was familiar with her before and we had interacted before, so it wasn't just a complete stranger. But being able to have that conversation, and then even meeting other people who are working in public health and different aspects of public health. So I also met somebody else who works in home care and occupational therapy and improving health outcomes for patients. And so how her public health workforce development helps improve patient outcomes. And so that's always so exciting because I think when people think about public health, they think about it in a certain way. They think about, oh, preventing people from getting ill, or, if maybe there's salmonella on something, because there's always salmonella on something, an outbreak. And how do we control that? Um, it is true, but just, controlling for those kinds of things, or how do we have a response to those things? And it's more so, how do we, instead of waiting for things to get to that point, what can we do in the steps leading up to, or what have we seen historically, and what can we do to intervene now to mitigate those instances of implicit bias in medical care? And what can we do to improve patient health outcomes? How can we train our staff? How can we train hospital administrators and so on, and educators, to be able to move in such a way that it's not just, oh, I'm in this particular role is fixed. No, these roles are actually quite flexible, even though we like to contain them in little boxes. I like to think that if you're doing it right, you're not necessarily just stuck in that one particular role. You're going to have a little bit of bleeding out at the edges to touch on these other different things, and you will not necessarily have a fixed square role. It will be a little bit more of a growing circle almost. It will it will
Yeah.
grow and it will
Yeah.
change and it will be more fluid than just that.
Yeah, you said it really well. I mean, this is an exciting field to be in the sense that it's not a one size fits all, and it overlaps so much, and we have to kind of move into kind of ownership of what we're doing. And as much as we're teaching, we're learning. As much as we're giving, we're receiving it, and we're just driven by the passion to really help and learn. And I mean, it'll never. I don't think it ever gets old.
No,
We just have so much to improve on, and so much work to do, and so much that needs to be done. I mean, it's not like we will solve it all or fix it all, but it keeps us, there's a plethora of things for us to dive into and really be able to see the impact, to see how it's making a difference and know that it's making a difference. So I appreciate you for coming on and sharing a little bit of this, some of the stuff that we talk about behind the scenes, coming on the podcast with me. I know you weren't super excited at the first mention of the idea. I'm so glad you changed your mind and you decided to do it. And I really hope that we'll be able to have more of these conversations. I think our audience will really appreciate being able to hear our perspective and hear more about the work that we do, and to not just hear me talk about it, but to bring on my team and to be able to talk about it. So
right.
I'm definitely excited to have you on the team and helping me serve our clients, and now being able to bring this to the podcast. So any final thoughts before we wrap up?
I think for the most part, I've covered as much. Otherwise, I'll go into another rabbit trail, and we don't have time for that today. But I just think, because there are just so many instances and examples that I could use. But I just think that overall, this has been really fulfilling, and just being able to see the things and apply the knowledge, or being able to kind of question what I've known to be true, or what I've accepted as the baseline for things. That has just been really enlightening. Just a lot more self-reflection, a lot more research, a little bit more searching on the internet, but it's really been able to enrich myself and my experience, and I'd like to think also the lives of the people around me as well. So I'm grateful for that.
Awesome. Well, thank you, Zuwena, for being here, and we'll chat again soon.
Awesome. Thank you so much.